I'm about to graduate nursing school. Where should I work? Hey guys, I'm Coley, a nurse here at UWorld, here with 5 things to consider when looking for your first post-grad job. First, depending on what specialty you like to go into, certain hospitals, centers, and clinics will actually have that type of unit in-house. For example, if you want to work in an ICU, some hospitals have different types of ICUs, from cardiac to neuro to the trauma ICU. Each care unit is separated. This could be good for you if you love critical care but want to focus mostly on one system. While other hospitals, usually smaller, could have just one ICU, where they handle all types of critical patients. This is nice because you get to learn the whole spectrum of critical patients, and it could also be a nice change of pace for someone who would like to see something different every day or every week. With that being said, the second thing you should consider is whether you would like to work in a big hospital or a smaller community hospital. Working in certain facilities has its perks to having certain resources, exposure to a broader array of diagnosis, to the technology and procedures the facility is able to manage. Not all hospitals are created equal, and oftentimes we see patients being transferred between facilities so they can receive more specific care or testing somewhere else. Another thing to consider is whether or not the facility has a graduate nurse residency program. Nowadays, a lot of facilities have structured programs to help ease nurses into patient care by bridging unit-specific classroom work with clinical experience. Like in the emergency department, they might rotate your orientation by working in the different zones, from triage to trauma bay, a couple weeks at a time. But some programs can last a couple months or up to a full year. Your program will also provide a preceptor to help mentor and guide you through these units' policies and procedures. A good graduate nurse program sets you up for a solid foundation in your nursing careers. It's important to choose wisely. Next, you should consider whether you like the faster-paced type of environment or would you rather a classic 9-to-5 routine. So think hospital versus clinic versus things like school nursing. Each setting holds a different level of acuity. Are you okay with every day and every patient being different? Or do you thrive best when you know the problem and then can have an already set course in action? Hospitals are a non-stop shop, 24 hours, day and night, weekends, and holidays. If that might be a deterrent to you, maybe the 9-to-5 will entice you more. Lastly, let's think logistically. Is your commute going to be a problem? Maybe traffic will be an issue if you work the night shift. Or if you work the night shift, who's going to watch your kids? The logistics and where you work might be the most important thing to consider when seeing how well you'll thrive at your new job. I hope these tips are helpful in shedding some light on where to work. For more helpful tips and all things nursing, be sure to follow and subscribe to our channel at UWorld Nursing on all social media platforms. And check out our lives every Tuesday, Wednesday, and Thursday. Thanks guys, and see you soon.